going to see the return of the dreaded mask mandates to American life over my dead body, but some California Democrats, if they get their way, masks could be making a comeback. In fact, a California congressional candidate, Joaquin Beltran, was elated after getting mask mandates reinstated in certain places, medical settings in LA County, posting on X, "We did it. Mask requirements are back in healthcare settings in LA County as of today, December 29th. Thank you to everyone who has been tirelessly working on protecting our community for months. You made this happen." California is not the only state to reinstate mask mandates. In fact, hospitals in Illinois, Massachusetts, New York, and also Washington, D.C. have all brought back rules mandating masks for select people in medical settings.
CBS News had a segment on the increase in new mask mandates. Let's watch.
New year, new concerns about a spike in COVID cases.
Our volume has really surged, and I attribute that to not just COVID, but influenza, RSV. I'm not seeing as many people fully immunized as in past years for flu, for COVID boosters, and so it makes them much more vulnerable.
The rise in infections has prompted at least 5 states to reinstate masking requirements at healthcare facilities as a new variant spreads across the country.
So, look, I will, off the bat, masks in medical settings are probably one of the less obtrusive ways because you're actually around people who are sick. And I more object to measures being taken, like, for the whole population, for certain whole populations where you have a lot of people who are obviously not sick having to do things that are inconvenient. At least if you're showing up to a doctor's office, a lot of those people are ill, so I would still make it voluntary, especially because, we can debate it, what the evidence, what the science says about the actual efficacy of masks, but I don't know, I haven't read this order. Does it require the high quality masks that maybe there's some evidence showing a beneficial effect to those? Or is it just, if you're wearing any old mask, we now know that a lot of those are practically useless, so then what's the point? Especially given, will certain people, I know an older person in my life who said they would never go back to the doctor's office if they had to wear a mask again. So is it doing more harm than good to have that kind of, we did it, we brought back masks attitude?
Well, there are also people who are immunocompromised who say that they cannot go to doctor's offices.
But they can wear masks.
Not that they're choosing not to go, but that they cannot go because they would be made vulnerable. It is not a choice in a medical setting where you often have to take your own mask off to get medical treatment, to be examined by a doctor, if you're going to a dentist, obviously you cannot be wearing a mask. If you're going to a dermatologist, you obviously cannot be wearing a mask. If you have to go to to get your lungs examined, to do those kind of breathing exercises, to get your tongue depressed, all of the ways that your mouth is implicated, your nose is implicated when you go to a doctor's office to receive treatment, require you to take down that barrier of protection. So I think that this is much more akin to the kinds of laws, the rationale around laws prohibiting smoking in public, which I'm sure you disagreed with at the time and maybe still disagree with. But the rationale there is people who cannot protect themselves, the folks who work in bars and restaurants, don't have the option of simply opting out. So at what point is there an obligation from society to not force people to have some pretty serious health implications because we won't all play ball and keep the community safer?
Well, isn't that an argument for the doctors and the nurses, not the other patients? I mean, when you're being seen in an examination room, you're with the you have limited contact. You can wear a protective. Again, you can protect yourself. I mean, the burden should be on people to take steps to protect themselves, not expect everyone else to go along with it.
When I went to a cardiologist a couple of years ago, I was asked to do a stress test in one room, walk to another examination room, walk back and forth between these areas. This is a hospital. There are a lot of people coming and going, and we also know that the more barriers that exist, the better protection that you have. If I have a high quality mask and you have a high quality mask, that's more protection than if just one of us do, for obvious reasons. If there's a failure in one of our masks and one of us doesn't have a high quality mask, it seems like you are acknowledging that there is value in a high quality mask, and you point to the failures of low quality masks as a explanation for why this policy is useless. But to follow through on that logic, you would want a mandate that was more restrictive insofar as that it can tell people not to mask up, but to wear a specific kind of mask in public.
I think the evidence eventually showing that, I think the efficacy of the strongest masks is still under dispute. I know there's some positive studies for it. There's none at the population level showing significant reduction of COVID and of mortality. And I know the early guidance to just wear a mask, any mask, being discredited makes me somewhat skeptical or suspicious that we won't eventually have that same attitude toward even high-quality
And that was
masks.
frustrating and wrong, and we've spent 3 years now talking about how bad that advice was. But now, I'm sorry, Rob, you're sitting here coughing. Everybody in my life is coughing. We all know that people are sick, and it's not just from COVID. It's from a whole cluster of things. And I observed over the holiday travel, people who I love and support, and I'm talking about my loved ones. I watched some of them, knowing they had colds, go and get on planes and travel without even self-masking to keep their own germs to themselves. And so I do worry that whatever you think about mandates, and I'm inclined to want to provide carrots rather than sticks, and provide positive incentives for people to wear masks, providing free masks and the like, instead of deploying mandates. But especially in a hospital situation, we're talking about vulnerable people who might avoid care precisely because hospitals are dangerous places for folks with compromised respiratory tracts and with all these respiratory diseases going around. That we should be having more of a conversation about the efficacy of these tools, which we very much do have at our disposal, and culturally encouring people to keep their germs to themselves.
That is very. I just think it should be. I think it should be people's choice. When I flew back from the holidays, I was quite sick. I wore a mask on the plane because I was actively coughing, and I wish I didn't have to fly, but I had to fly, so I wore one because I was actively sick. I think when you know that you're sick, taking precautions for yourself. Again, I don't know that it does any good. I don't know that the air filtration on the plane isn't sufficient to override anything. But I did it. Well, we don't know.
It's so ridiculous.
But anyway, I did it. But that was my choice. I don't think otherwise healthy people, it should be forced on them. And I don't think there's enough scientific evidence to override that, leaving it to people. Just the same way it is with the vaccine, where there's enough of a public health deterrent. I mean, that would have to be a very high bar to clear, making you get vaccinated. It would have to do what they actually promised, stop the spread, the contagion of the disease, which it didn't do.
So first of all, a vaccine is an infinitely more significant abridgment of your bodily autonomy than a face mask. And I really it has always boggled my mind that the anti-vaccine mandate crowd was not more pro-mask. Obviously.
But that's subjective. Some people don't feel that way.
Okay. And subjectively, getting slapped on the wrist is less harmful than getting shot in the head. That's subjective.
Well,
come on.
No.
Injecting a foreign body into your blood is quite literally a more significant abridgment of your bodily. It is breaking your skin barrier and abridging your bodily autonomy in a way that placing a temporary covering over your mouth simply is not. That's like saying a no shoes, no shirt, no service policy at 7-Eleven is a more significant abridgment of your bodily autonomy because they force you to put a covering on your chest before you go and buy a slushie.
Yeah, but it is because some people were going to get vaccinated anyway, and so it didn't matter to you if you made them do it because they already did it. Whereas having to, again, not wear a mask, once a year if you're going to the doctor's office. I'm not pretending this is the most draconian thing ever to happen in society, but the kind of broad, you will put on a mask every time you go outside or any social setting whatsoever. Well, that I did find absolutely more, especially because there's no legal, or let me finish, there was no legal, historical precedent for making people take those kinds of draconian efforts for an unlimited amount of time. I mean, the public health officials talked about us doing that until we had zero COVID, which were never going to happen.
All right, look, if we're going to spend the next 3 to 5 years talking about policies from 2020 and 2021, you can have your right to do that. But right now, today in America, there are a number of respiratory viruses that are spiking. Everybody that I know is sick, including my
you were sick too.
I was also
sick.
I was also sick. And I feel like it is damaging and dangerous to be overly focused on policies that were overturned literally years ago as we're having a contemporary conversation about how to safeguard the health and well-being of the public. And to take a story about a very limited application of a mandate in a clinical hospital setting. Again, neither of us have read this order, but the way that they even frame it as a clinical setting in a hospital suggests to me that we're talking about treatment areas as opposed to waiting room areas. The idea that that conversation can't be had without stretching back to 2001 and talking about how wrong the CDC was to advocate for cloth masks that didn't work, I agree with you. I agree with all of that. But how much airspace has to get always taken up with that conversation instead of simply talking about whether or not this application is clinically mandated or scientifically or health supported?
How I'm likely to view the efficacy of masks in this, and we're just like, I'm not disagreeing. If you are sick, I have always from the beginning advocated for people who are actually ill should practice different behaviors, like staying home if you can, and if you have to go out, then absolutely consider that. I just think it should be voluntary and it should be focused on people who are actually ill. Right now, that is a lot of people, unfortunately. But I do have questions, and I've read a lot of the studies. We've talked about a lot of them about whether you can actually demonstrate significant efficacy even of the better mask on a population level.
The population level stuff doesn't matter if nobody's wearing high quality masks. Yeah. When's the last time? But
you can't. Nothing's stopping you from doing it.
But the studies show. Okay.
We're just arguing whether people.
No, but this is important because saying masks don't work and then pointing to a population study where nobody was wearing the masks that work helps to convince people that masks don't work, when the true and accurate thing that is supported by scientific studies that demonstrate the various capacities of different masks is that high quality masks do work. If you wear a respirator, an N95 or a KN95, you lower your odds of testing positive by 83%. That goes down to 66% for a surgical mask and 56% for a cloth mask. So even the cloth masks, they don't work nearly as well, but it's even dishonest to say that those, quote, do not work. If I were sitting here and you knew that I had COVID and was hacking up a lung, would you prefer that I be sitting here doing it right in your face, or that I cover my mouth or wear even a cloth mask? I mean, what would you prefer, common sense-wise, if we were sitting here and you knew that I had COVID and a cough?
I don't care. It would be no different
Robby.
than if you had any other, if you were sick.
Or
and occasionally
flu.
we do have to sit next to each other.
And a flu and a cough. Right. And we have one of these jobs, just like in the hospital setting,
where
we can't help
power
it.
Through it.
And our makeup artist has to be exposed to us maskless, and all the people around us have to be exposed to us maskless. So there are people who are in situations where you don't have the opportunity to rely on one-way masking.
But all those people, but you've just said, if it is true, and I don't know whether it is, but let's say it is true, that that finding is absolutely correct, and it's an 85% reduction for wearing that mask. That is pretty significant.
Yes.
And you are pretty well protected then if you do that, and we don't have to put any obligation on someone else. You can just choose to do that yourself.
Right, except for what we just finished talking about, Robby, which is people like ourselves who don't have the opportunity to wear masks at work, who cannot wear a mask at work, or who have to take off their mask to get clinical treatment in the very kind of hospital setting that we're talking about.
Sometimes, we can't make the perfect the enemy of the good.
I'll tell you this, before I started working here, I was working from home for the first 2 years of the pandemic. I did not expose myself to COVID. I didn't get COVID, and I was never in a situation where I was really exposed, because I live alone. I don't have to. I don't have kids. I don't have people coming in and out of my house. And that you can protect yourself. Well, and when I came to work here, one of my biggest concerns was the exposure. And do I wish we lived in a world where our makeup artist is very serious about COVID and is always masked with a high quality mask. And I appreciate it because she's up on our face every day like this.
I don't care, but everyone can do whatever they want. That's just, you do what makes sense for you, and that's how I want everybody to live their lives, and that's what I want public policy to reflect. But that's our disagreement.
All right, stick around. We have more Rising for you right after this.